Boa tarde, meu nome é Germana Titonelli, eu sou neuroradiologista do HC, FM USP e do Grupo Fleury. E agora nós vamos dar início às sessões de trabalhos no módulo de neuroradiologia. Como debatedor, nós vamos ter o Dr. Gustavo Novelino Simão.
Boa tarde,
Boa
Germana.
tarde.
Boa tarde a todos. Eu sou Gustavo Novelino Simão, sou médico radiologista da CEDIRP em Ribeirão Preto e do setor de neuroradiologia do Hospital das Clínicas da Faculdade de Medicina da USP.
O nosso primeiro trabalho a ser apresentado vai ser com o título de Segurança do Gadopiclenol para imagens por ressonância magnética, uma análise combinada de 8 estudos. O autor, apresentador, é o Dr. San Juan. Dr. San Juan é proveniente do Instituto de Epilepsia, do Instituto de Neuroradiologia e Neurocirurgia da Cidade do México e do Departamento de Radiologia da Universidade da Carolina do Sul, Estados Unidos.
Thank you so much for this opportunity. My name is Daniel San Juan, and this is the talk of my clinical research work, the safety of gadopiclenol in MRI studies. So this is my disclosure. All these clinical trials are supported by Gerbert Company. How you know, gadopiclenol is a new macrocycle GBCA, and it's one of the newest enhancement contrasts approved by the FDA at 0.05 millimole per kilogram, and currently is under review by the European Medical Agency in this union. So this molecule have the ability to have this high kinetic stability, and the ratio of the R1 and R2 relaxivity is 2 to 3 times higher than the other current available GBCAs at different MRI machines. Previously, the MRI studies in neuroradiology, especially phase 2 and 3, using this dose of the gadopiclenol, show that in this clinical trial design, the no inferiority comparing with the gadobutrol at 0.1 millimole per kilogram in terms of the lesion visualization, including these ordinary variables, the border delineation, the internal morphology, and contrast enhancement. So also it's very relevant to show that this has a similar contrast to noise ratio comparing with other very famous enhancement that is the gadobenated at 0.1 millimole per kilogram. You can see in this graph in 2 patients. The first patient is 65-year-old male with brain metastasis from lung cancer, and the difference using different dose of the gadobutrol and gadopiclenol at 0.05 millimoles per kilogram. And the other patient is a female, 48 years old, with a glioblastoma. And you can see that it's very clear to define the lesion in both studies and using the half of the doses that is expected. So, So we analyzed the safety information from all clinical trials we conducted during decades of research. And you can see the distribution of the patient, mainly adult patient, less of 50 years old. But we include all the phase studies, and so you can now see 1,000 or 1,000 patients received gadopiclenol. You can see also the distribution of the adult patient, the pediatric population. We have at least the 2 years old, the lower limit of the pediatric population, and the distribution according to the body regions, mainly in this, from the brain or spinal cord lesions, or in the body MRI that include thoracic and pelvic MRIs. So we use the post-injections safety evaluation with adverse events, laboratory measures, vital signs, and electrocardiograms to analyze the relation between the infusion and the side effect that we can see in the clinical trials. So that's the results. We see the adverse events are very similar comparative with the other drugs. The adverse drug reaction is not so different between the three comparisons, active comparison. And maybe it's more relevant to speak about the serious adverse drug-related events. And you can see using Gadopiclenol is less of 1%. And the intensity is usually mild, moderate, and self-limited. So usually we don't expect to apply any specific treatment. So, one moment. I want to move. Yeah, so this is the analysis of the adverse drug-related adverse event with Gadopiclenol. You can see 2 patients have upper abdominal pain, increase of the blood creatinine mild in the post injections, but all are very mild and auto-limited. So you can see also the similar incidence with Gadopiclenol for patients with or without history of the allergies. You can see now in the list of the table, the injection of the site is most pain is the most common, but there are others that maybe are related or no, because some of the patients have their own pathology that can induce, for example, headaches, or are not specific like fatigue, diarrhea, dizziness, etc. But we collect all the data, but you can see the list of the side effects. In terms of the laboratory measure, vital sign and EEG, we don't see particularly any abnormalities except this increase of the blood creatinine, but they are similar to the gadobenate or gadobutrol. So we analyze by regulatory requirements the QT intervals, and also we don't see any change. And this is very interesting data because include a pediatric patient using this dose of the Gadopiclenol. And you can see we don't have only 2 patients with no serious adverse event that include a QT interval prolongation in 1 kid 5 years old with any clinical significant relevance, and other that develop macular papular rash, also limited after 1 week. But other measures, especially by the biochemical parameters, hematology, or other QT abnormalities, were relative, not significant or no difference comparing with the other drugs. So in conclusion, our crossover study, especially using Gadopiclenol, show a very high safety profile comparing with the other drugs available in the market. Most of the adverse events reported by the Gadopiclenol were mild in severity. Some of them are related with the injection site reactions like pain, coldness, or local edema, and others are not specific like headache, nausea, diarrhea, or fatigue. But still, the prevalence of the side effects related with the drug is very low. And also, if the patient have or not history of the renal impairment before, is not a big concern. And also the history of the previous reaction to the other medical condition or drugs. So in terms of the other parameters like laboratory measure, vital signs, or EKG abnormalities, we don't find any specific issue. So Gadopiclenol at this 0.05 millimole per kilogram have a very high good safety profile, using also in pediatric population. And now we can consider the use of this drug, and of course with the medical indication more frequently, but with less dose. Thank you so much for your attention.
Muito obrigada, Dr. San Juan, pela palestra. Excelente trabalho, uma grande casuística. Eu vou abrir Dr. Gustavo Simão para alguma pergunta, alguma discussão sobre esse trabalho apresentado.
Boa tarde, San Juan. Parabéns pela apresentação. San Juan, eu gostaria que você... Eu vou falar primeiro em português, depois eu falo em inglês. Eu gostaria de saber de você quais que você acha que são as principais limitações deste trabalho. Então, can you explain us what are the main limitations in this work?
Or I think like any other clinical trial have own limitation, but now we have a wide spectrum of the patient treated, but maybe the patient less than 2 years are not included. That is the initial limitation, because we know that the neonate or other pediatric population. Also, we have the general overview, the safety, but maybe now we need to see specific pathologies, because we need to be more precise depending on the etiology, and also we have the data, but we need to analyze the data for a specific history, or what kind of the allergy, or if the patient have a very severe renal failure and is possible or no, or what are the special indications. But at the moment, the profile is very good, and we don't see any evidence of this relative nephrogenic systemic fibrosis in a study. So that is other thing that when you don't see anything, maybe it's the good news. You need to see a catastrophic, of course, but I think these are the two limitations: the age group, specific etiology, be more precise about the history of the renal function.
Okay, thank you. And about the image quality, how did you perform that?
Oh, yeah. All the clinical studies were evaluated from different centers, because it's a multi-center, multi-international nationality, but still we have another central committee to review all the data. But of course, we consider the expert of the local neuroradiologists. We only include a neuroradiologist to evaluate the quality of the imaging. But you know that the scales of the variables are ordinary. We don't have the specific precision to measure the amount of the signal or not. But at least for the MRI ratio noise, I think we have this international standard to evaluate the quality of the imaging with different MRI machine also.
Yes.
Mm-hmm, yeah.
And,
Ótimo. Obrigado.
I have one question about your data. Do you intend to analyze different pathologies like multiple sclerosis, that it's interesting to analyze the sensibility of the gadopiclenol? What do you think about this part of the study?
Yeah, I think it's very relevant for the clinic to have the precision in each pathology, but we need to analyze this 1,000 of the MRI and comparison with the others. But in this case, we focus in the safety at the moment. But maybe in the efficacy, that is the next step, is under review now in the publication. Yeah.
Ok.
Yeah.
Gostaria de agradecer, então, Dr. San Juan, pela apresentação.